Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, and Fire Chief Darren Rizzi, and Mickey Frost, our Director of Works and Operations and Maintenance. Scott Holmes is here, too, to take any questions about our winter maintenance. I first want to take a moment to express my sincerest condolences to the family, friends, and the entire Malton community who are facing an unimaginable loss right now. On Tuesday evening, a young teenage girl, Tafash Riley, lost her life to gun violence. This is nothing short of tragedy, and frankly, I'm outraged that someone would take the life of a 14-year-old girl. I know Peel Police are working around the clock to investigate and bring justice to her family. My thoughts and prayers are with the Malton community, and I grieve along with them. I also want to address another issue that has been in the news over the past few days. I am disappointed and frankly very angry about the disturbing allegations that Councillor Ron Starr repeatedly vandalized former Councillor Karen Rass's car in a secure parking garage at City Hall. It's also sad that this was one of the reasons that led to Councillor Karen Rass's resignation from council. This is flagrant bullying and harassment and has no place at the City of Mississauga or in any workplace. The situation was an active police investigation, which I fully cooperated in, and I respected the councillor's wishes at the time to keep this matter confidential. Over the last few days, I reflected deeply on this, and I realized that I should have done more for Karen and for the residents of Ward 2 and for our city. I'm not sure if Karen is watching, but Karen, I'm truly sorry. As a friend and a colleague and as mayor, I should have pushed harder for the Integrity Commissioner to investigate. I'm a woman in politics, and I've been on the receiving end of harassment myself. And as the leader of council, I should have done everything in my power to protect my friend and colleague. I should have pushed our Integrity Commissioner to open an investigation on this once the criminal investigation was closed by police. Councillors must have a means to address issues such as bullying and harassment in the workplace. If our Integrity Commissioner will not pursue his own investigation into matters that also involve the police, then there's a glaring gap in our system that must be closed as soon as possible. What's important now is that we've made some meaningful change so a situation like this never happens again. Yesterday, Council voted unanimously to request that our Integrity Commissioner undertake a full investigation into the situation at hand. We also voted for Councillor Starr to take a leave of absence until the investigation is complete and the results presented to Council. I urge Councillor Starr to respect the process and the outcomes. We will also find out why the Integrity Commissioner chose not to pursue an investigation in the first place. I do want to be very clear that these incidents do not reflect the nature of Mississauga City Council as a whole. I'm extremely proud of the positive, collegial relationships that many council members share and the work we've accomplished together to better serve the residents of Mississauga. But there's always room to improve. This incident shows we have work to do, and I want all Mississaugans to know that we are fully committed to doing better. And now for my COVID update. I'm starting to feel a little more optimistic about the future, and I think Dr. Lowe will agree with me. Last week, we reached a huge milestone with 90% of residents 12 plus fully vaccinated, and we are narrowing in on the same for all residents 5 and older. And the even better news is that Peel has passed the peak of the Omicron surge, and we can continue to take steps to protect ourselves as we look to the future. While the situation in our hospital and our long-term care homes, like so many across the province, is still very challenging, there are signs of hope and brighter days ahead. The percentage of people testing positive for COVID continues to decline, and for the third week in a row, and PCR tests are being processed much faster. Our business community is on the road to recovery, with bars, restaurants, and gyms reopening their doors. Along with our community and cultural centers, our fitness gyms, and libraries here at the City of Mississauga. We're also starting to reach a point where we're learning to live with the virus. Several leading public health experts, including Dr. Tam and Dr. Lowe, of course, have said that the vaccination helps make Omicron infections less severe. As such, we continue to adjust our approach to Omicron, as we now know it's an entirely different variant than those that came before it. By no means does this mean we're giving up or that the wheels are off the wagon. In fact, it's the opposite. It's up to us now to use all the tools we have to blunt the impact of this variant. That means getting vaccinated, getting boosted, wearing a mask, and making the right decisions when gathering with family and friends as the surge resolves. Which brings me to our booster rates here in Peel Region. We need to get them higher. Just because Omicron tends to be milder for the vaccinated does not mean you don't need to get boosted. While 2 doses gives some protection against the severity, its ability to protect against infection slowly decreases over time. It wanes. Boosters provide better protection from getting infected in the first place and can augment your protection against severe outcomes like hospitalization and death. Dr. Lowe and Peel Public Health continue to work to make it as easy as possible to get boosted, and I want to thank them for their efforts, particularly to secure both Pfizer and Moderna at all their clinics to make the decision easier for those who want to have a choice of an mRNA vaccine. And I'm happy that Peel Public Health is launching 2 more versions of Doses After Dark on Saturday, February 5th from 1 p.m. to midnight at the Save Back Centre in Brampton, followed by one in Mississauga's Rockwood Mall on February 12th from 1 p.m. again to midnight. This provides people with greater choice and flexibility in their schedules, which is most definitely a good thing. And I hope it encourages more people to get out and get their first, second, or booster doses. And on that note, I'd like to invite Dr. Lowe up to speak. Thank you. Dr. Lowe, please come up to the podium.
Thank you, Madam Mayor, and good morning. The Omicron surge in Peel and Mississauga continues to resolve. Our wastewater trends have begun to decline, and our hospital picture is starting to stabilize. However, intensive care and ward use still remains at high levels, and as we reopen, I must urge all Peel residents who haven't yet been vaccinated or boosted to do so without delay. If you're over the age of 5 and need your 2 doses, please get vaccinated as soon as possible. Parents, please arrange for your children to get vaccinated as soon as you can. We know that providing the vaccine for children protects them against severe outcomes and hospitalizations, and also provides certainty in their day-to-day interactions. If you're over the age of 18 and haven't yet gotten your booster, you can make a difference for your friends, family, and loved ones by getting protected with your booster today. Anyone who is eligible, either over 5 and needing first 2 doses, or a booster and over 18, can walk into any Peel-run vaccine clinic today or visit peelregion.ca/COVID-19 vaccine to book an appointment at a time convenient to you. Our focus continues to be preventing severity if one is exposed to Omicron. And with contact and transmission anticipated to rise as we reopen, getting vaccinated and boosted is critical to getting the best protection that you can get. It's all how we move forward together with confidence individually and together. In fact, it is the collective actions that we have taken that have made a difference in getting us to this point of transition. And for that, I want to thank all of our residents and all of our small businesses and everyone who has made a difference on the front line in our healthcare system and our first responders. Thank you. We can't waste our immense efforts. Let's get boosted now to increase certainty. Last week, Dr. Kieran Moore, our Chief Medical Officer of Health, declared that it is time to learn to live with COVID. And I know that this has raised many questions in our community. Firstly, I want to be clear that I welcome this shift in approach at this time. I also want to be clear that contrary to what some might say, such an approach would not have been possible at points earlier in the past 2 years. Before vaccines, we were facing a novel virus for which we were all susceptible. And regrettably, elsewhere in the world, we saw the consequences that eventuated when communities got it wrong. Even Peel, as a hotspot community in a pre-vaccine era, saw so many friends and family sickened, hospitalized, and regrettably lost. However, our strong collective efforts have continue to make a difference. For the past 2 years, you stayed home when you were sick, you sacrificed to reduce contacts when it mattered, and you masked as much as possible in public. And when the vaccine came, we all trusted the science and stepped up to get protected. And the numbers are clear here in Peel. 3 million doses delivered, 90% of our 12+ population protected with 2 doses, which helped to suppress Delta, which ravaged many other communities worldwide and have drawn us into this transition here in our community. Once more, though, we need to step up again together. With Omicron now the dominant variant, we need to get boosted. Against Omicron, 2 doses plus a booster transforms a COVID-19 infection from something that is uncertain and potentially catastrophic into something that is far more manageable. So please, if you're unvaccinated and older than 5, you remain at the greatest risk. Walk in today for your first 2 doses. For adults, vaccination reduces hospitalization risk by 6 times and ICU risk by 10 to 12 times with COVID-19 infection. If you're older than 18 and you have your 2 doses, and especially if you're over 50, please get boosted as soon as possible as we reopen. This booster is essential for making sure you have the best protection you can. We have 600,000 residents, including 200,000 over the age of 50, that are eligible for boosters this month. And we also have 2 excellent vaccines, Pfizer and Moderna, that are available in our clinics that you can choose from. Even if you've had a previous infection, getting boosted can help to solidify your protection. Get boosted, reduce the risk of severity, and get boosted for certainty so that we can continue to transition and move on. Thank you, and I'll pass it back to you, Madam Mayor.
Thank you, Dr. Lowe. Over the last few weeks, we have seen a rash of house fires across the GTA, including a tragic one in Brampton that took the lives of 3 young brothers. I don't think we talk nearly enough about the risks of fire and the things that we can all do to prevent them from happening in our own homes. And that's why today I have invited our fire chief, Darren Rizzi from Mississauga Fire and Emergency Services, to give us some important tips on fire prevention and safety over the winter months. Chief Rizzi, the floor is yours.
Thank you, Mayor Crombie. Good morning, everyone. The start of the year was exceptionally challenging for firefighters. We have seen positive news stories about residents being rescued safely from a fire in our own community, but only a week later, we are grieving the loss of 3 young boys from a neighboring municipality. According to the fire marshal, there has been a string of 9 fire incidents in Ontario last month that has claimed the lives of 17 people. It isn't a good way to start 2022. These events are heartbreaking to both the members of the responding fire service and the impacted community. Fire officials and firefighters across the province are sounding the alarm in hopes to protect people and slow the upward trend. We are urging people to be particularly mindful of fire safety measures. Fire and life safety is top priority for our department year-round, but especially during the winter months. Today, I want to make sure it's top of mind for you as well. As you would expect, during the winter, we see people spending more time indoors as temperatures drop below freezing. Winter storms can bring an unexpected challenge with snow, ice, and wind. As a result, we see an increase in the use of space heaters and wood-burning appliances, as everyone's furnace gets a good workout when the settings are adjusted to keep us comfortable. Along with more time spent cooking hot meals, these are just a few of the factors that contribute to a spike in fires over the winter months. Something we can all do to protect ourselves at any time of year is to have working smoke and carbon monoxide alarms in your home. Test your alarm monthly to make sure they work and replace the batteries regularly. If you haven't checked your smoke and carbon monoxide alarm recently, please make that a priority as soon as possible. Fires can happen at any time, anywhere in your home, and having working smoke alarm is the best line of defense. In addition to making sure you have working smoke alarm, I want to remind you of some of the actionable steps you can take to prevent fires in your home. 1, never leave cooking unattended. Always keep an eye on what you're cooking and never leave your home with food on the stove or in the oven. 2, inspect all electrical cords inside your home. Frayed cords, overused extension cords, and faulty wiring can cause fires. Please take a moment to unplug any lingering holiday lights or decorations that have been forgotten. Also, be careful not to charge devices under pillows or other places they could overheat. 3, service your furnace and change filters. Make sure you've done the recommended maintenance on your furnace or heating source. Not changing the filter could lead to overheating. 4, check your closest fire hydrant and ensure it's accessible. Responding to a fire in the winter, especially after a big snowstorm, can be challenging as the fire hydrants may be covered in snow. 5, use space heaters safely. Make sure they're not in close contact with curtains, furniture, or something that could catch on fire. Don't plug them into extension cords or run them for 24 hours, 7 days a week, and please keep them away from water. Lastly, one of the best tips I can offer parents or those who care for young children is to teach them about fire safety. Tell them it's okay to call 911 if a fire starts. I've heard too many stories of kids being afraid of getting into trouble from their parents or fearful for calling for help. And be sure to keep lighters and matches away and inaccessible from children. Our public education staff have attended 41 virtual classroom sessions since January and have reached more than 800 students. I really look forward to the day when Mississauga Fire and Emergency Services public education staff get back into schools and classrooms in person to talk to kids of all ages on fire safety. I know that day is coming soon. Our website has great tips to learn more about fire safety. You can visit our website at www.mississauga.ca/fire safety. Thank you, and I will pass it back to Mayor Crombie.
Those are mine. Yeah, that's mine too. Ooh, thank you. Oh, it's yours. Thank you, Chief Rizzi. This is such a critical and timely message for our residents that I know is going to help save lives. Before I take questions from the media, I wish Mississaugans, those celebrating a vibrant, those in our East Asian communities who are celebrating the Lunar New Year earlier this year, a very happy Year of the Tiger. I wish you, your family and friends, nothing but peace, good health as you ring in the new year. And lastly, While it's fresh on our minds, I want to briefly address the protests in Ottawa last weekend and those planned across the GTA this weekend. We can disagree on politics and on public health measures. Everyone is entitled to their opinion and the right to free speech. But when people start sharing messages that encourage violence, waving symbols of hate, desecrating sacred war monuments, vandalizing the statue of hero Terry Fox, harassing shelter staff, and even taking meals away from the homeless, that's where I draw the line. And I know many Mississaugans and many Canadians feel the same. It's been an incredibly difficult 2 years for everyone. And for the most part, as Canadians, we have done an amazing job making the best of it and doing our part to show compassion and care for our families and friends and our most vulnerable neighbors. I applaud those who have sacrificed and who have done their part. We are all frustrated. None of us wanted to be in this situation, but most of us know that by working together, we will get out of it sooner. And now, along with Dr. Lowe, Chief Rizzi, and Mickey Frost, and Scott Holmes, we're all happy to take questions from the media. First question, please. First question, please.
Hello, sorry, having some audio difficulties. Can you hear me?
I can hear you now. Thank you.
Okay. Your first question comes from Khalid Salama at My Second Home TV.
Okay.
Go ahead, Khalid.
Welcome, Khalid.
Good morning. Good morning. First of all, thank you so much for updating about Lone Star. The point is, any clarification about why all this started in the first place?
Khalid, let me just say how disappointed I am, how angry I am, and how disturbing I think these allegations are with respect to the repeated vandalization of Councillor Rass's car. You have to understand that there was an active police investigation going on at the time, and that Councillor Rass confided in a very small number of us, but asked us also to keep it confidential. So we weren't aware of all the facts that the press seems to be aware about at the time. And it wasn't until after the police investigation was wrapped up that Councillor Rass had gone to the Integrity Commissioner, who chose not to investigate because it had been a police matter. This is when I think I could have, and the rest of us could have, stepped in and said, yes, this is a matter we want you to investigate. But of course, it's very difficult to interfere in an ongoing complaint and investigation, even by the Integrity Commissioner. So yesterday, as a council, we came together and we decided that we would insist that the Integrity Commissioner investigate the matter, and we've asked Councillor Starr to please take a leave of absence until the matter has been dealt with and has been closed. Thank you.
Thank you, Justin. The other question for you and Chief Rizzi.
Sure.
How many of these fatal incidents and fires stemmed from the basement?
Oh, from the basements. I'm going to let Chief Rizzi respond to this. Thank you, Khalid.
Thank you.
Good morning. Thank you for the question. Can you repeat it again? How many stem in the basement? So the majority of our house fires that we're seeing right now stem from unattended cooking, meaning people have started something on their stove or placed something in their oven and then have either left the room or left the house entirely. The second cause would be improperly discarded smoking material. So either that's off of balconies onto other people's balconies where there's combustible material, or say, for example, they're smoking in their garage and then they improperly discard the smoking material.
Okay, and Chief Rizzi, if you please, how long it will take for an investigation to indicate exactly where did the fire started and the cause of the fire? Thank you. In
terms of an investigation, it would certainly depend on how how much resources is required. So I'm not sure if you're talking about one fire in particular, but I mean, it could be anywhere from we could finish an investigation that day if it's a simple outcome, or sometimes when we have to bring in excavators, it could literally be months before an investigation finishes. So a difficult question because each fire is different and the origin and cause of the fire is different, so it requires different resources.
Thank you.
Okay. Next question, please.
Your next question comes from Declan Finnegan at Mississauga. Go ahead, Declan.
Welcome, Declan.
Thank you. Mayor, you've said publicly recently that you have nothing but praise for former Councillor Rath. She's the type of councillor that's needed, et cetera, et cetera. Yet the city's actions, or rather inaction here, hasn't backed that up. Essentially, it seems you seemed okay with letting her leave. Were there any issues you or council had with Karen Rath and her performance as a councillor?
I think Karen Rath was an exceptional councillor. It'll be a huge loss to our council. She's very dedicated. You know, she was the budget minder and very chair of the CVCA at one point, active on audit and government relations committee. Very dedicated community person as well. She has many resident groups that she attended and serviced their needs. I think that for a number of reasons, and Karen has chosen, I thought she was just chosen to resign early, and that's a very unfortunate decision. And I know clearly that this bullying and harassment issue has been a part of it.
Follow-up?
Yes, please. Thank you. Mayor Crombie, you didn't get into earlier what caused the issue between Councillor Starr and former Councillor Rath. Do you not know what led to that, or are you just not prepared to talk about it publicly at this point? Councillor Rath herself, in her statements to the media, has said she enjoyed a positive and collegial relationship with Councillor Starr, so it's not for me to speculate on what the cause may have been. And we also have to keep in mind that Councillor Starr continues to deny the allegations, but clearly Councillor Rath was harassed and bullied. Her car has been vandalized and damage was done. But on the whole, our council works very collegially. We're very cooperative, and I think we're a very high-functioning council. We get a lot done, and we serve the interests to promote our agenda and build the best city we can.
Your next question comes from Isaac Callan at The Pointer. Go ahead, Isaac.
Hey, Mayor Crombie.
Welcome, Isaac.
Thank you. Yesterday, Council passed an EMZO request for the new Mississauga Hospital.
Yes.
Last time I asked you about this, probably about a year ago now, you listed some pretty specific reasons for requesting MZOs. Significant job creation, long-term care were the two that stood out. Was an EMZO really the only way to get this land rezoned?
And the other benefit that had to come from an MZO or an EMZO, not only job creation, affordable housing, long-term seniors care, but also community benefit. And of course, the hospital is going to provide a huge community benefit. We're building a world-class hospital, it'll be one of the largest hospitals in Canada with over 950 beds just at that one site. So we're very, very proud of it. It'll be 22 stories tall. And of course, everything is on a timeline. And the hospital site itself is zoned for institutional use, but the parcel in the front where the Camilla Care Seniors Long-Term Care Center resides is residential use. And because the hospital is on such a tight timeline for their funding to get built, the rezoning process could have taken 18 months to 2 years. And of course, we want to get the hospital up and built as soon as possible. So we have requested the EMZO for the larger community benefit.
Perfect. And you obviously have personal ties with the Liberal Party, the Ontario Liberals, have effectively promised to get rid of NZOs if they're elected in June. Do you support that campaign promise?
Let me just say that I have no ties to any party. I'm not a member of any party. I once served as a federal member, but I am here working in the best interest of the city of Mississauga. While we don't approve of frequent MZOs, there are situations where we can support them as long as the council has asked for one and there is a greater community benefit, or it's job creation related, or affordable housing or long-term care related, is something we can stand behind.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Welcome.
Mayor Crombie.
Thank you. Welcome.
Just curious if you've spoken with Councillor Starr since all of this came about, and I also wondered if the allegations that he vandalized Ross's vehicle repeatedly are true. Do you think he should resign?
I have reached out to Councillor Starr. I have phoned him. I have texted him. I have not communicated with him. He was at council yesterday. He wanted to make a statement to our council members when we went in camera, and then he left and declared a conflict of interest. So he was not part of any of the discussions that were made. Clearly, I think, Steve, there is a process that needs to be followed. As we know, Councillor Starr is denying the allegations, and we have asked that the Integrity Commissioner conduct a full investigation. And we're very hopeful that he will now do that council has insisted on it. He declined Councillor Rass's request to conduct the investigation some months ago, largely because he felt it was a police matter and a criminal matter. But now, with the force of council behind this motion, I'm hoping that he changes his mind and conducts the investigation. So I think we need to wait for the results of the investigation before we ask anyone to resign their seat. And you know that we cannot compel anyone to resign their seat, but we would certainly, we have asked Councillor Starr to step aside, take a leave of absence while the investigation is ongoing. Presumably there will be one. And at that time, we'll have to wait and see what the results of the investigation brings, Steve. I really don't want to speculate on next steps, but you know that there is no power for council to compel anyone to take the leave of absence or to resign their seat, but certainly moral suasion is our only resource.
Follow-up?
Yes, thank you for that. I guess I just wanted you to elaborate more on this piece you mentioned around you recognized that after the police had dismissed the investigation, there was a moment there where you could have pushed for an integrity commissioner, a more thorough investigation into this. Why, can you take us through why at that time, recognizing this, you didn't do that?
So when the Integrity Commissioner opted not to pursue an investigation upon Councillor Rass's request, he cited the reason of the criminal nature and that it be better investigated by police, and felt it wasn't his role. Now, at that time, I could have and should have asked myself for him to consider conducting the investigation. I think there's more strength in that request now that it comes from full council, but I feel that there are some gaps. Certainly, if there is a councillor that feels harassed or bullied, there should be an opportunity for the Integrity Commissioner to investigate. There is a glaring gap in our code of conduct that it doesn't address these serious issues and leaves them to be a police matter, and the police feel the matter is resolved and have closed the file, and yet the complainant, Councillor Rass, the victim, doesn't feel the issue has been sufficiently addressed because there's no resolution for her. She felt as though she had been harassed and bullied. So there are some glaring gaps in our code, which, as a group, we are going to discuss and see if we can undertake with the Integrity Commissioner to fill those voids. Now, some of it is outlined in the provincial act, but this is where change has to be made in our own code of conduct that seems to serve us well for some smaller matters, but on these larger issues, there was no resolution. I think it was at that point that I could have inserted myself, even though it's difficult to interfere in another person's complaint. But as mayor, maybe I erred on being too cautious, and I should have pushed a little harder myself, and I blame myself, and I'm asking for Councillor Rass's apology to accept my apology. I'm truly sorry. I could have done more and should have done more, but I think now, with the force of the motion that Council has made, that perhaps the Integrity Commissioner will reopen it. And then we can discuss through Governance Committee and through Council how we close those glaring gaps when there is no resolution for the complainant.
Mayor Crombie, that was your last question for the day.
Thank you for joining us today.